I went for my first mammogram. They found some spots. The radiologist at that time said, "You don't, this is nothing, this is a baseline, this happens to everyone." And then I went to a more diagnostic mammogram where they detected cancer. I was floored. I never in a million years thought that at age 40 that I could be diagnosed with breast cancer. I felt like I'd always taken care of myself. I exercised regularly, and I could not figure out what I could have done to get cancer. It was all a whirlwind of questions and feeling so rushed because I wanted to get the cancer out of my body. So I went in and I had the surgery. I had a mastectomy, a skin-saving mastectomy of the left breast in March of 2008. I was in pain, sad, really wondering if I had done the right thing. My surgeon told me that more than likely, since I had the mastectomy, I would not have to do chemo or any therapy after, but that he wanted me to see an oncologist at the hospital just to make sure that everything was okay and that my margins were clear. Went to the oncologist, and the oncologist sat down with me and immediately told me that I was going to have to go buy a wig and that I was going to get a port put in the next week. I went home and I immediately started looking at other options. And Mayo Clinic came up. Checked into my insurance, and thank goodness my insurance covered it, and I had a second opinion at Mayo Clinic, and Mayo Clinic is where I stayed. I went to my second opinion with Dr. Marino, and he spent an hour and a half going over my pathology results from the mastectomy, giving me several different options of what my treatment path could be. He gave me statistics on survival and never once discussed my mortality. He put the care in my hands and made me feel like life was going to be good again, that life was going to go on. Since I am a mother, I had 3 kids that were 10, 8, and 2 at the time. I knew that this was going to be a difficult time and very difficult to try to work everything in with chemo and doctor's appointments and everything else. What Mayo did was walk me through it. They let me make my own decisions and create my own schedule without feeling like I had to be there every single time, or you know, if I couldn't make it, they rescheduled, had no trouble with that. And so it gave me more time to be a mom and to be a wife and to move on without having to worry so much about when I was being cared for. It was like coming to a second home. As bad as the experience was, it was a pretty good experience for what I was going through. I would like for everybody to know that your life is going to be normal again. Somebody told me that when I was going through chemo, and I remember thinking, there's no way, but it does. It goes back to normal, and it is almost even better because you appreciate it so much more. My name is Kim Loving. I'm 43 years old. I live in St. Augustine, Florida, and I am a breast cancer survivor.